Hi guys, today we're going to talk about the prone horizontal abduction, which is one of the most common arm care exercises that you'll see done in the baseball world. But we're also going to build on top of it and talk about the progression that I like to use to make it maybe a little bit more functional, so what we encounter with our throwers. That said, we'll start with the prone horizontal abduction and actually go through some of the most common mistakes and then talk about how we build on it. It's also known as a T, so as the name implies, we want to see about a 90-degree angle between the humerus and the upper body. So as Frank comes up here, one of the most common mistakes that we'll see is we'll see guys actually hang out down here. What that creates is a very lat dominant pattern. It creates a situation where the humeral head, so the ball, tends to ride forward on the socket. We actually see kind of like an anterior tilting of the scapula. So in many cases you can get right in there and palpate that inferior medial border of the scapula kind of jumping off the rib cage. So one of the first things I'll do when I'm teaching people and I see that issue is I'll actually get right up and I'll block them off so they can only go to that 90-degree angle. Okay? The second thing that we'll commonly see here is that individuals won't understand how to differentiate between scapulothoracic and glenohumeral motion. So scapulothoracic, shoulder blade moving on the rib cage is what we're looking for, so we can get some good mid-trap recruitment versus just grinding away through the arm. So what I'm going to have Frank do is just keep his shoulder blade right where it is, and we'll show you a bad pattern. And this is especially prominent because Frank is a little bit more hypermobile, and you realize that he can actually get up to the end position that we think is good, but in reality, he's gliding forward, irritating the front of the joint. So as his arm comes back, the ball slides forward in the socket. So instead, we want to make sure that motion kind of initiates through the scapula, and then arm comes along for the ride. So wherever your scap goes, your arm should go, and vice versa on the way back down. You'll notice he's not crashing down. It's more just medial lateral movement of the scap, arm comes along for the ride. One of the analogies that we'll sometimes use with people is imagine the shoulder blade is doing the lifting and the arm is the weight, okay? So in terms of progressing this, what I like to do is actually integrate it into an upward rotation pattern. So we'll have Frank initiate things, arm comes along for the ride, and then we're actually going to try to get him to kind of swivel that shoulder blade on the rib cage as he takes his arm up towards his ear, and we're going to bring him back down to that start position and then essentially control him down. The other thing I want to be really cognizant of is make sure the neck stays nice and relaxed. I usually tell people double chin, scap towards the midline, arm comes out and around. The analogy I'll usually use is teach them about a clock. So imagine that arm is going to try to make that big kind of quarter circle from 9 to midnight as they work through it. So great exercise, just make sure you do it correctly, and then when you progress it, you can gradually start to load it up. Most people start with like a 2.5 pound plate and wouldn't necessarily advance past using like 7.5 pounds or so.